Hello,
Hello.
I'm Josh. I'm a Radford student, nurse practitioner student. I'm
Nice to
working with
meet
my
you.
preceptor today, so I'm going to be talking with you a little bit. Before we get started, do you mind, may I get your verbal consent? We'll be filming this
Sure.
video. All
Absolutely.
right, good.
Thank you.
Let me get my hands washed real quick and we'll get started. So it looks to me like you're here for an annual physical exam.
Mm-hmm.
How's everything going?
Pretty good.
Okay, good. Any complaints with anything today?
Mm-mm.
Okay. So a little bit of, can you talk to me a little bit about your past medical history?
A history of some pre-diabetes,
Okay.
or questionable pre-diabetes.
Okay.
That's pretty much most of it.
All right. Any tobacco use at all?
Mm-mm.
Any alcohol use or recreational drug use?
Socially with alcohol, maybe
Okay.
2 drinks a week,
All right.
and no drug use.
Okay. Good. Have you had any past surgeries?
No.
All right. Are you taking any prescription medications? Any herbal remedies? Any over-the-counter medications at all?
No. Occasional ibuprofen if needed
Okay.
for the occasional aches and pains.
All right. How about? Are you married?
Yes.
Okay. Do you live at home?
Yes.
Do you feel safe at home?
Yes.
Okay. Good. How about any history of headaches?
Mild. Nothing
Okay.
significant.
Any blurry vision? Any pain in the ears and the joints,
Mm-mm.
in your jaw?
Uh-uh.
Okay. Any sore throat?
No.
Fever, cough, shortness of breath?
No.
Okay. Have you had any swelling in your neck that you've noticed at all?
Mm-mm.
Have you had any chest pain or palpitations?
Mm-mm.
Okay. No cough, shortness of breath, any
No.
syncope or dizziness upon standing?
I'll leave you two alone. Hey,
No.
Okay. Have you had any belly pain at all?
No.
All right. Any change in bowel or bladder?
No.
Any increase in frequency or burning with urination?
No.
All right, good. Have you noticed any tenderness in your abdomen at all?
No.
All right. Any nausea, vomiting, diarrhea? Excessively? All right. Have you had any painful or swollen joints?
No.
Back pain?
No.
All right. Any breast tenderness?
No.
Any unusual vaginal bleeding?
Mm-mm.
All right, good. All right, so I looked at the nurse out front, got your vital signs. They all looked good. Your blood pressure was 128 over 72. Your heart rate was 68. Respirations were 16, and your oxygen saturation was 100%. So that all looked good. I did notice we're charting with your BMI went down a little bit. You're at 30. We're looking at 28 now.
Okay.
So that's a good thing. What have you been doing to?
Just been trying to watch portions and walking a little bit more.
Okay. How often are you walking every day?
I would say 4 days a week,
Okay, good. How far are you walking?
about 2 miles.
Good, good. How about what's your typical diet look like?
Often I don't eat breakfast. Lunch usually includes a salad, and some type of starch or grain, and usually some lean protein.
Okay.
And then dinner varies based on what we fix, but it usually includes a protein and a starch and a vegetable.
Good. So you're not eating any breakfast, is that correct?
That's correct.
All right. How come?
Usually on the go,
Okay.
not hungry. I have my morning coffee, and that usually holds me over.
Okay. So breakfast is a very important meal,
Mhm.
especially with the history of
Right.
prediabetes, because you don't want your sugars kind of all over the place. You want to keep them more,
Right.
balanced. So I know you did say you're on the go. Maybe you can look at some options like a smoothie option, or maybe a couple hard-boiled eggs and a banana, something like that in the morning. But it is important to kind of get a little bit of meal
Okay.
upon awakening,
Okay.
just to kind of help. As you're coming out of sleep, your body's kind of in that starvation mode, and you'll need to give us some energy.
Okay.
Okay, and that'll help with the blood sugars too.
Sure.
Okay. So what we're gonna do is I'm gonna do a little physical exam here real
Okay.
quick, if you're okay with that,
Absolutely.
and we'll move on. So,
Okay.
any tenderness here in your head?
Mm-mm.
Okay. Tenderness down here at all? All right, good. I'm gonna take a look in your ears here.
Is there any wax?
No, but I did share something with you that's super cool. I mean,
What did you see through the other side?
All right, just look straight ahead for me, please. Make sure I'm getting, all right, good. I know the lights out. I do not. All right. If you would, just follow my finger. Very good. Any tenderness through the neck here at all? All right, good. Go ahead and shrug your shoulders for me. And push against my hand. And push against this hand. Good. All right. I'm going to take a listen to your heart. If you would just breathe normal for me. And take a couple of deep breaths for me, please. Alright, perfect. Just going to feel your pulses here. And if you uncross your legs for me, I'll just check the pulses down here while we're at it. Alright, very good. And if you would, just lay back for me. I'm going to take a listen to your belly. And I'm just going to fill in your belly here. Any tenderness at all?
No. Sorry.
All right.
I'm extremely tickled.
Okie dokie. So, let's check your reflexes here. All right, so the physical exam looks good, everything that we've looked at. So what we're going to do today, if you don't mind, I'd like to do a little bit of blood work. We're going to do a CBC, which is going to check your white blood cell count, some blood levels, hemoglobin, hematocrit, and we're going to do a comprehensive metabolic panel, which will look at some electrolytes, some liver function, just some basic labs like that. Also, have you eaten at all today? Okay. We may go ahead and just go ahead and do a cholesterol test as well, and we'll take a look at that. And I also want to take a look at your hemoglobin A1C. So what that does, it gives me a range of your blood sugar over the last 3 months. So where you're pre-diabetic, that'll give us an idea of where we're at and where we need to go. And hopefully we can control this with, you said you've been walking 4 days a week. Your diet sounds pretty stable. Just get you eating some breakfast, and hopefully we can control that with diet and exercise, and we don't need to go to medication or anything further down the road. Also, I'd like to talk to you. Have you had a flu shot this year?
No, I'd like one today.
You'd like one today? All right, perfect. I'll have the nurse come in and we'll get you a flu shot. When was your last pap smear?
Last year.
Okay. Any abnormal findings on that?
No.
All right, so you're all up to date
Yes.
with OB/GYN?
Yes.
Okay, perfect. How about tetanus? Are you up to date with your tetanus?
Should be. I got one with my last child who's 5.
Okay, perfect. All right, so we'll conclude. I'll walk you down to the lab and we'll get this blood work and we'll move on.
Perfect. Thank you.
All right, thank you.
Thank you.